Breast is a symbol of femininity. Women lose confidence when they have smaller breasts, large breasts, or breasts that are sagging. Aesthetic breast surgeries include breast enhancement procedures, breast reduction, removal of accessory breast tissues from the axilla, and breast lifts. Although many options are available in the market for breast enhancement, like creams, massages, vacuum-assisted devices, and many more, all offer only temporary solution. Permanent solution is offered only by implants and fat grafting. Implant could be a silicone or a saline implant. A patient who wants to undergo breast enlargement using an implant should choose the size, the plane of insertion, and the approach. Size is chosen by the patient depending on the existing size and the skin elasticity. The plane could be subglandular, submuscular, subfacial, or dual plane depending on how the patient chooses after learning all the advantages and disadvantages of the procedure. Approach is chosen by the patient depending on where she needs the ultimate scar. It could be at the axilla, it could be at the periareola, or under the breast. Breast enlargement using fat grafting is a good alternative to enhancement using implants. However, fat can get absorbed with time and multiple sessions may be required. This is also a surgical procedure. Fat from the patient's own body is taken and filtered, washed, and reinserted into the breast. However, the shape with an implant remains permanent, while fat can get absorbed. Breast enlargement procedure could be performed after the development of breast is completed, anytime after 16 to 18 years of age, provided the patient does not have any comorbidities like diabetes, high blood pressure, other ongoing infection in the body. Breast enhancement using an implant is a safe option in experienced hands. However, anyone undergoing breast implant procedure must be aware of rare complications like capsule contracture and infection of the implant. Both these complications have to be managed either medically or surgically. Breast enhancement procedures, be it implant or fat grafting, could be done either under local or general anesthesia. Patient needs to be at rest for a period of 1 week, and vigorous exercise and fitness activities could be resumed after 6 weeks. The procedure is done as a day care and the patient could return home the same day. Large and sagging breast results in shoulder pain, underbreast infection, bra strap pressure ulcer, and many more problems. A solution to all these problems is reduction mammoplasty or breast reduction surgery. In this procedure, the breast is reduced in size and lifted up. At the end of the procedure, there will be a permanent scar, more visible in darker skin. Patient may encounter problem while lactation. They could develop milk cyst. However, breast reduction procedure is a safe procedure. Patients suffering from shoulder pain, embarrassment, huge breast definitely would benefit from reduction mammoplasty. Reduction mammoplasty is done under general anesthesia, and anyone undergoing the procedure must be off work for a period of 2 weeks. Women after multiple pregnancies and lactation end up with loose sagging breast and loss of volume. This is corrected by a surgical procedure called breast lift or mastopexy. The breast is lifted to its original position. This is a surgical procedure and there would be a scar at the end of the procedure. The scar is not visible in lighter skin, however, in darker skin visibility is more. At the end of the procedure, there would be a permanent scar. The scar is less visible in a lighter skin, however, the visibility is more in skin types 4 to 6. Many women have lumps at the axilla. These are accessory breast tissues. In the embryo, breast tissue develops in the axilla and descends to its current position in the chest. Residual breast tissue at the axilla results in what is called accessory breast tissue. These lumps enlarge during periods of lactation and behaves like a normal breast tissue. They could be removed surgically by liposuction along with excision of the excess skin. Anyone undergoing breast reduction procedure must be aware of rare complication. Inexperienced hands, rarely they could use the nipple areola complex. They could use the sensation of the nipple. Patient must be aware that there will be a permanent scar after the procedure. However, breast reduction in experienced hands is a safe procedure